Welcome. It's a great pleasure for me to introduce Polish medical platform in the GCC. We're an entity gathering Polish professionals into medical field, as well as local partners utilizing Polish products, Polish services or Polish knowledge in the GCC area. Believes in direct contact with client, with business partner. That's why we offer to Polish companies, the strong Polish companies, that they are together with Consortium of Medical Services, along with Polish medical platform, the GCC, to meet partners, future partners for the business development in the area of the GCC. In the several seconds, I would like to introduce the profile of the company, VIGO Ortho, a big company working in Poland, also in Europe, presenting the knowledge and skills into the orthotics, prosthetics, and many other additional equipment that are required by special patients and their needs. In platform, we believe that going to exhibition is a great idea. You can get good contacts, but this what we offer as a Polish medical platform in the GCC. We agree on organizing tailor-made meetings with some certain companies that we know that profiles of both companies from Poland and GCC, they are quite even and they would understand each other. This is the way to actually make the better business, cooperate better, and present the products to the local market. We would like to promote Poland and be more recognized as a quality partner for medical treatment, for medical practitioners, for the medical equipment that might be implemented in the GCC area. It's a great pleasure to meet with local partners, introduce them to our partners from Poland, and make the strong connection. This is our aim.
Very broad portfolio, but major focusing on custom-made products. So individual approach, custom-made, and of course, our competitive advantage is know-how, knowledge. We know what is necessary to be delivered to the particular patient. Yeah? We are close cooperating with the leading universities in Belgium, Leuven, Ghent, the Netherlands, and also in Poland. Yeah? So we are close connected to the University Medical Society and opinion leaders. So today we consist of, we are operating in 3 major countries, again, Belgium, Netherlands, and Poland. This is our European.
In Poland you have more than one branch.
Yes, today we have 7 branches and 20 consultation offices. Yeah, but Poland is quite a big country, so that's the reason. Here you see the branches in Belgium. We are definitely the leader. I think there is no exact data, but I think that we are the leader in custom-made orthopedic business in Europe. Not only in Belgium, not only in Poland, but I think that as a group, we are the leader or one of the biggest companies for sure in the whole Europe, because this business is pretty segmented, and we are one of the leaders, if not just the leader. This is our premises in Belgium. We have several buildings that we operate and have all the facilities. And then, again, this is only part of our portfolio, yeah, the VIGO products. So starting from the orthosis, prosthesis, aesthetic prosthesis, and epitheses. Epitheses are the cosmetic prosthesis for the ears, nose, and eye. I will show you later on. Something special, which I think might be a great interest for the Gulf region. This is the DINA Sleep. This is the new, totally new and very advantaged product, like a bed, kind of the bed, which allows patient to fix the position. We have also the wound treatment, so some special silicone equipment which allows patient after the burn, yeah, to improve their status and avoid the complications like keloid, like construction of the scarf, etc. And also we have our, let's say, prefab, so off-shelf product line. We call them VIGO line, but this is, I think, the custom-made. Anyhow, this is our main focus. If we are talking about the orthotics, we have really the very broad branch of the products. Yeah, from the upper, for the lower limb, for the upper limb, body jackets, helmets. So everything which is, let's say, from the bottom till the head of the patient. Yeah? And this is, of course, also our area of expertise. The second segment is prosthesis, again from the, let's say, from the basic, but of course we are specialized also on the premium segment. So again, what is, for example, not possible to have here in Gulf area, the top premium prosthesis, which requires, for example, from the component suppliers special certificates, we have, and we are able to deliver directly. Then we have also, I think, something special which is unique also in Europe, I must say, but I think that also for this region. This is the cosmetic prosthesis and epitheses. They are the special prosthesis designed for the cosmetic purposes. Yeah, so you can have the prosthesis of single finger, many fingers, hand, forearm, arm. Yeah, and also you can see for the patient, this is the fascial prosthesis. We call them epitheses. They are the prosthesis for the patient with, as you can see, after the operation without the nose. We create silicone prosthesis, which is artwork, handmade, painted with the vascular, everything if necessary, with some even the small changes of skin, just to be very natural. And this system here, you have the ears. This system of the fascial prosthesis are fixed to the body, to the head, by the special system of implants. Yeah, so here you need the cooperation of the surgeon. The surgeon is putting the implants to the desired place. We may advise how to fix this, and then patient has the prosthesis, for example, of the ear or of the nose, and based on the click, it just click, he is fixing or taking out for the night. So it's very easy to manage, and the results is here. Like, I can show you the typical. Yeah, this is for ear, this is for nose, and this is for orbit, yeah, the eye. And then you have system of fixation, and here you have the final work. It is really state of art that the people from the very difficult conditions are able to recover just the normal professional private life. And also, of course, we are doing, as I mentioned, the fingers, arms, and also legs. They are everything cosmetic. It's possible, for example, to put the tattoo even on the head to really to be 100%, let's say, natural. With these aesthetic products, there is, of course, no need for any implants. This is fixation is based on the decompression. Okay. Yeah, it's just put and it just works. Yeah. For the fascial, you need this implant. So you need to have the cooperation with the surgeon. Yeah. In that. Here, it is 100% done by the CTO or by the orthopedic technician. Yeah. Here is father. Yeah, the lady without the eye, and here is the final work. So it's not just opposite that was the healthy patient and after the treatment, but just reverse. The lady after the treatment, surgeon treatment, because mainly of the cancer, for example, or trauma, and then final work, final result. The same for the ear. Yeah, here with these implants, and here you can see with the hairs, with everything which is very natural. Okay, a few words about our technology, how we work. Again, our major focus is custom-made. So, and in case of custom-made orthopedic equipment, the key element is taking the measurement of the patient, of the leg or the head or whatever. Yeah? And we are doing that in two ways. The traditional way, it is making the model and the plaster using the dips. It's normal, yeah? Plaster. Yeah, that's typical.
The molding, the molding.
Yeah. But also as a standard procedure, and we are doing today, I think more than 50% of our patients, we are using the modern technology. It means scanning. We scan the body of the patient. We are using variety of scanners from Artec is one of the examples, but in this area the technology is moving pretty fast. So now we can also use the ASUS scanners, very simple and also very cheap. And then we have, let's say, the model of the body virtual. And then in traditional way, we have to correct the model by hand. Yeah. But in this case, we can use the special software what we have. We are using Rodin 4D software. So then it is, for example, this is the example of correction of body jackets, yeah, because this is the most difficult to correct because of the size, etc. But then, so we have the virtual model of the patient. It looks like that, and based on the software and first of all the knowledge and know-how of our CPOs, everything, the correction is done virtually. Yeah, that we change, we can fix, we can improve, we can check, and then the file is sent to our central fabrication, where this is the example of the robot. Robot is having 3 dimensions, so it's able to carve in 3 dimensions, and the final result is just the model. Run, yeah, so
it's like 3D printing.
This is a little bit like that. However, it's not directly 3D printing, yeah, because we are making the model out of block, and robot is carving, yeah, based on the numeric pattern. We are using 3D printing for this facial prosthesis to help doctor to position, to imagine how the missing part of the face should look like. Yeah. Here is just having the block and then carving the exact model of the equipment. Okay, and there's also a few words about the DINA Sleep. This is really something unique. We received for that product, which is pretty new, we received the silver medal in for the medical innovation last year. For Benelux, yeah, for countries, Belgium, Netherlands, Luxembourg, etc. So it is something which we spent and we developed for more than 3 years. And this is the system, let's say. We call them DINA Sleep because it's really dynamic orthosis, which allows to put patient in the correct position.
Okay, so it comes like a matrix. We get it with a matrix. So he be sleeping in the
during the day, during the night, and you very easy, quick. You can change the position of the patient based on your needs, on the physiotherapist's needs. Yeah. For example, for night position, to stay, let's say, relaxed, the patient is one of the position. Yeah. For the day, even with the sitting position, yeah, you can adopt. And then within, let's say, few minutes, you can change, you can adopt, you can build like a sitting, yeah.
Okay.
But it is movable. That's why it's dynamic.
And is it a memory foam or
It is
a memory foam like this one?
No,
The system,
no.
not memory foam. So it's fixed.
It's fixed on the way you want. It stays that way.
It's stable, very
It's not
stable.
a fill-out form.
yeah. We have several, let's say, layers. Every layer is dedicated for the purpose, yeah, or was developed for the purpose. Also in terms of the materials, every material is rethinked, and it is really the modern or the best technology available in terms of the flexibility, physical features of the material, and also, for example, easy to care, because all this stuff you can easily wash on more than 90 degrees. So you can basically cook them and of course sterilize. So this is very universal type of the,
It's much better than temperature.
yeah. And overall, you have the system of the, let's say, blankets, I must say, several layers that allows really to fulfill certain functions, and you have the set of the pillows, special pillows, and the fixation elements. In the combination of that and the layers, you are able to construct the bed and fix the position of the patient. So you are using that as a classical pillow, but they are not the classical pillows, because they are again specially prepared, specially developed, that, for example, are giving away the heat, which is, I think, important here. And also they are keeping the position not withdraw, yeah, which usually you put the pillow and the pillow has the tendency to go out, yeah, from the head or from the body because of the pressure. Here is the special construction and special, again, materials for that they are stay as it was designed. And then we have the fixation element that allows, let's say, really fix the part of the bed. So here, for example, it's put this fixation element, supports, and it is just like a wall, yeah, fixed, so the patient cannot move, is just in the right position. So this is, let's say, very high technology and special kind of the materials. Again, we spent to develop this product for more than 3 years, but today we are happy and satisfied that it was recognized as one of the best innovative medical products in Europe, basically. We have 3 sizes of this product only, let's say, from the infant till the adult, and if the patient is interested, they will just purchase and we can deliver, yeah, without any issue. Then we have this wound treatment, the special silicones, again to improve the status after the burn situation. Of course, apart the product lines, we have the whole bunch of the expertise and know-how. For example, we have the special gate laboratories where we can observe and verify the functioning, the walking pattern, behavior of the trunk of the patients, etc. So this is also for verification of functioning of our products. Also, VIGO is involved in sports. We are doing, of course, first of all for the disabled persons, but our patients are able to sail our patients are able to bike, to run, to play a football. Also, we are supporting, for example, Anderlecht, a football club from Belgium, and top athletes, so Lukaku and other people. Our patients are playing golf on the prosthesis. Yeah, here you have the runners. Here we have the team of the amp football. They are the football players who are using the
Crutches.
Crutches, yeah. You see here. So they have one leg, but they are going on to crutches, yeah, and they are playing with one leg football. But very impressive. That's it.